Question 1. A nurse prepares to enter the room of a client diagnosed with pulmonary tuberculosis who is receiving negative pressure isolation. Which action demonstrates correct infection control practice? A. Wearing an N95 respirator before entering the room. B. Wearing a surgical mask after entering the room. C. Wearing sterile gloves and a gown only. Or D. Keeping the patient's door open to improve airflow. The answer is A. Wearing an N95 respirator before entering the room. Rationale. Tuberculosis requires airborne precautions. A properly fitted N95 respirator must be applied before room entry. Question 2. A client with suspected meningococcal meningitis is admitted to the emergency department. Which precaution should the nurse initiate immediately? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. Or D. Protective isolation. The answer is B. Droplet precautions. Rationale. Meningococcal meningitis spreads via respiratory droplets and requires droplet precautions. Question 3. A nurse accidentally sustains a needle stick injury after administering a subcutaneous injection to a client with unknown infectious status. What is the nurse's priority action? A. Report the incident to the supervisor. B. Wash the site with soap and water immediately. C. Complete an incident report. Or D. Begin post-exposure prophylaxis. The answer is B. Wash the site with soap and water immediately. Rationale. Immediate cleansing reduces pathogen transmission risk and is the first action after exposure. Question 4. A nurse is caring for a client with Clostridium difficile infection. Which infection control measure is essential when exiting the room? A. Alcohol-based hand sanitizer. B. Soap and water hand hygiene. C. Chlorhexidine hand rub. Or D. Sterile hand washing technique. The answer is B. Soap and water hand hygiene. Rationale. C. difficile spores are resistant to alcohol-based sanitizers. Soap and water are required. Question 5. Which client requires protective or reverse isolation precautions? A. Client with pulmonary tuberculosis. B. Client with severe neutropenia from chemotherapy. C. Client with MRSA wound infection. Or D. Client with active varicella infection. The answer is B. Client with severe neutropenia from chemotherapy. Rationale. Protective isolation prevents infection in immunocompromised patients. Question 6. A nurse removes gloves after wound care for a client with MRSA. What is the next action? A. Perform hand hygiene. B. Remove gown. C. Document procedure. D. Exit the room. Answer. A. Perform hand hygiene. Rationale. Hand hygiene must occur immediately after glove removal. Question 7. A client with active varicella is admitted. Which healthcare worker should not be assigned to this client? A. Nurse who previously had chickenpox. B. Nurse vaccinated against varicella. C. Pregnant nurse without immunity. D. Nurse wearing an N95 respirator. Answer. C. Pregnant nurse without immunity. Rationale. Varicella poses significant fetal risk and requires immune caregivers. Question 8. A nurse prepares to transport a client on airborne precautions to radiology. Which action is appropriate? A. Apply N95 respirator to the patient. B. Place surgical mask on patient during transport. C. Cancel transport procedure. D. Use full sterile isolation. Answer. B. Place surgical mask on patient during transport. Rationale. Patients on airborne precautions should wear a surgical mask when leaving the room. Question 9. Which organism requires contact precautions due to multi-drug resistance? A. Mycobacterium tuberculosis. B. Varicella zoster virus. C. Methicillin-resistant Staphylococcus aureus. D. Neisseria meningitidis. Answer: C. Methicillin-resistant Staphylococcus aureus. Rationale: MRSA spreads via direct contact. Question 10. A nurse is preparing to insert a central venous catheter. Which intervention best prevents central line-associated bloodstream infection? A. Sterile gloves only. B. Maximal sterile barrier precautions. C. Chlorhexidine mouthwash. D. Surgical mask for the patient. Answer: B. Maximal sterile barrier precautions. Rationale: central line insertion requires full sterile technique to prevent CLABSI. Question 11. A nurse caring for a client with active pulmonary tuberculosis notes the negative pressure system has failed. What is the priority action? A. Transfer the patient immediately to another airborne isolation room. B. Close the room door and apply surgical mask to patient. C. Notify respiratory therapy. D. Document the system malfunction. Answer: A. Transfer the patient immediately to another airborne isolation room. Rationale: airborne isolation must be maintained to prevent transmission. Question 12. Which pathogen requires both airborne and contact precautions? A. Influenza. B. Varicella. C. Mumps. D. Rubella. Answer: B. Varicella. Rationale: varicella spreads via airborne droplets and direct contact with lesions. Question 13. A nurse caring for a patient with Ebola virus disease should prioritize which PPE sequence when entering the room? A. Gloves, gown, mask, goggles. B. Gown, mask, goggles, gloves. C. Mask, gown, gloves, goggles. Or D. Goggles, gloves, gown, mask. Answer: B. Gown, mask, goggles, gloves. Rationale: PPE is donned in a sequence ensuring barrier protection. Question 14. A nurse notices a colleague exiting a patient room wearing contaminated gloves while touching the IV pump controls. Which infection control principle is violated? A. Aseptic technique. B. Standard precautions. C. Environmental contamination prevention. Or D. Surgical sterility. Answer: C. Environmental contamination prevention. Rationale: contaminated gloves should not contact clean equipment. Question 15. Which hospital-acquired infection is most strongly associated with prolonged urinary catheterization? A. Ventilator-associated pneumonia. B. Catheter-associated urinary tract infection. C. Central line bloodstream infection. Or D. Surgical site infection. Answer: B. Catheter-associated urinary tract infection. Rationale: indwelling catheters are the primary risk factor for COTI. Question 16. Which disinfectant is most effective for eliminating Clostridioides difficile spores from hospital surfaces? A. Alcohol-based solution. B. Hydrogen peroxide wipes. C. Bleach-based disinfectant. Or D. Chlorhexidine solution. Answer: C. Bleach-based disinfectant. Rationale: bleach solutions effectively destroy CD difficile spores. Question 17. A nurse performs tracheal suctioning for a client with ventilator-associated pneumonia risk. Which measure reduces infection risk? A. Routine saline installation. B. Closed suction system. C. Suctioning every hour. Or D. Removing ventilator humidification. Answer: B. Closed suction system. Rationale: closed suction systems reduce contamination and VAP risk. Question 18. Which isolation precaution is indicated for influenza infection? A. Droplet precautions. B. Contact precautions. C. airborne precautions, or D, protective isolation? Answer A, droplet precautions. Rationale, influenza spreads through respiratory droplets. Question 19. A nurse observes a physician inserting a central line without performing hand hygiene. What is the nurse's best action? A, document the observation. B, immediately intervene and request hand hygiene. C, notify infection control later. D, file an incident report after procedure. Answer B, immediately intervene and request hand hygiene. Rationale, patient safety requires immediate correction of infection control breaches. Question 20. A hospitalized client develops fever, leukocytosis, and purulent drainage 4 days after surgery. Which infection is most likely? A, surgical site infection. B, ventilator-associated pneumonia. C, blood transfusion reaction. D, catheter-associated UTI. Answer A, surgical site infection. Rationale, typical postoperative infection timing and symptoms indicate SSI. Question 21. A nurse preparing to care for a client with scabies infestation should implement which precaution? A, airborne precautions. B, droplet precautions. C, contact precautions. D, protective isolation. Answer C, contact precautions. Rationale, scabies spreads through direct skin contact. Question 22. Which isolation room characteristic confirms airborne isolation is functioning correctly? A, positive air pressure. B, 6 air exchanges per hour. C, negative pressure airflow. D, door open ventilation. Answer C, negative pressure airflow. Rationale, airborne rooms maintain negative pressure to prevent pathogen escape. Question 23. Which procedure requires surgical asepsis rather than medical asepsis? A, dressing change for superficial wound. B, urinary catheter insertion. C, oral medication administration. D, blood glucose monitoring. Answer B, urinary catheter insertion. Rationale, invasive procedures entering sterile body sites require sterile technique. Question 24. A nurse caring for a client with herpes zoster, localized, should implement which precautions? A, airborne only. B, contact only. C, droplet and contact. D, airborne and contact. Answer B, contact only. Rationale, localized shingles requires contact precautions if lesions are covered. Question 25. Which factor most increases risk of ventilator-associated pneumonia, VAP? A, frequent oral care. B, supine positioning. C, early mobilization. D, head elevation. Answer B, supine positioning. Rationale, supine position promotes aspiration and pneumonia risk. Question 26. Which vaccination is mandatory for healthcare workers to prevent nosocomial transmission? A, hepatitis B. B, tetanus. C, polio. D, rabies. Answer A, hepatitis B. Rationale, hepatitis B protects healthcare workers from blood-borne exposure. Question 27. A nurse prepares to collect a sterile urine specimen from an indwelling catheter. Which action maintains sterility? A, disconnect catheter tubing. B, obtain sample from drainage bag. C, use sampling port with sterile syringe. D, clamp tubing for 1 hour. Answer C, use sampling port with sterile syringe. Rationale: samples should be drawn from the port using sterile technique. Question 28. A client with measles is admitted. Which precaution is required? A. Droplet precautions. B. Airborne precautions. C. Contact precautions. D. Protective isolation. Answer: B. Airborne precautions. Rationale: measles spreads via airborne transmission. Question 29. Which intervention is most effective for preventing hospital-acquired infections overall? A. Isolation rooms. B. Routine antibiotic prophylaxis. C. Hand hygiene compliance. D. Patient vaccination. Answer: C. Hand hygiene compliance. Rationale: hand hygiene remains the most effective infection prevention measure. Question 30. Which situation represents a break in sterile technique during wound care? A. Sterile field above waist level. B. Turning back on sterile field. C. Using sterile gloves. D. Opening sterile package away from body. Answer: B. Turning back on sterile field. Rationale: sterile fields must remain within constant view. Question 31. A nurse caring for a client with pertussis should implement which precautions? A. Airborne. B. Droplet. C. Contact. D. Protective. Answer: B. Droplet. Rationale: pertussis spreads through respiratory droplets. Question 32. Which patient is at highest risk for healthcare-associated infection? A. 22-year-old with appendicitis. B. 45-year-old with asthma. C. 72-year-old with diabetes and Foley catheter. D. 30-year-old postpartum patient. Answer: C. 72-year-old with diabetes and Foley catheter. Rationale: age, chronic disease, and invasive devices increase infection risk. Question 33. Which infection control strategy reduces central line infections? A. Daily line necessity review. B. Routine antibiotic therapy. C. Daily catheter replacement. D. Continuous saline flush. Answer: A. Daily line necessity review. Removing unnecessary lines reduces infection risk. Question 34. A nurse caring for a patient with CRE, carbapenem-resistant Enterobacteriaceae, should prioritize which precaution? A. Droplet. B. Contact. C. Airborne. D. Protective. Answer: B. Contact. Rationale: CRE spreads via direct contact. Question 35. A nurse removes PPE after leaving an isolation room. Which item should be removed last? A. Gloves. B. Goggles. C. Mask/respirator. D. Gown. Answer: C. Mask/respirator. Rationale: mask is removed last to avoid respiratory exposure. Question 36. Which action helps prevent catheter-associated UTI? A. Routine bladder irrigation. B. Maintaining closed drainage system. C. Daily catheter replacement. D. Prophylactic antibiotics. Answer: B. Maintaining closed drainage system. Rationale: breaking the system increases infection risk. Question 37. Which isolation precaution is appropriate for RSV, respiratory syncytial virus? A. Airborne. B. Droplet. C. Contact. D. Protective. Answer: C. Contact. Rationale: RSV spreads primarily via contact with secretions. Question 38. Which situation requires immediate infection control reporting? A. Medication error. B. Cluster of hospital-acquired infections. C. Patient fall. D. Equipment malfunction. Answer. B. Cluster of hospital-acquired infections. Rationale. Clusters may indicate an outbreak requiring investigation. Question 39. Which factor most contributes to antibiotic resistance in hospitals? A. Delayed treatment. B. Excessive antibiotic use. C. Isolation precautions. D. Sterile technique. Answer. B. Excessive antibiotic use. Rationale. Overuse drives microbial resistance. Question 40. Which infection requires contact precautions due to spore formation? A. Influenza. B. Clostridioides difficile. C. Tuberculosis. D. Rubella. Answer. B. Clostridioides difficile. Rationale. C. difficile produces resistant spores requiring contact precautions. Question 41. A nurse caring for a neutropenic client should avoid which action? A. Fresh flowers in room. B. Hand hygiene. C. Private room. D. Mask use by visitors. Answer. A. Fresh flowers in room. Rationale. Flowers may harbor bacteria harmful to immunocompromised patients. Question 42. Which infection requires droplet precautions? A. Rubella. B. Tuberculosis. C. Measles. D. Varicella. Answer. A. Rubella. Rationale. Rubella spreads via droplets. Question 43. Which is the most common hospital-acquired infection? A. Caudy. B. VAP. C. Surgical site infection. D. Bloodstream infection. Answer. A. Caudy. Catheter-associated urinary tract infection. Rationale. Catheter-associated UTIs are the most frequent HAIs. Question 44. Which step is essential when removing a contaminated gown? A. Pull from the neck outward. B. Roll gown inside out. C. Shake gown before disposal. D. Remove after mask. Answer. B. Roll gown inside out. Rationale. This prevents contaminating clothing. Question 45. Which infection control measure is critical in preventing surgical site infections? A. Antibiotics after surgery only. B. Preoperative antibiotic prophylaxis. C. Delayed wound closure. D. Continuous wound irrigation. Answer. B. Preoperative antibiotic prophylaxis. Rationale. Timely antibiotics significantly reduce SSI risk. Question 46. Which organism is transmitted primarily through blood exposure? A. Influenza. B. Hepatitis B virus. C. Measles virus. D. Norovirus. Answer. B. Hepatitis B virus. Rationale. HBV spreads through blood and body fluids. Question 47. A nurse observes multiple cases of diarrhea among patients on the same unit. Which infection should be suspected first? A. Influenza outbreak. B. C. difficile outbreak. C. MRSA infection. D. Tuberculosis. Answer. B. C. difficile outbreak. Rationale. Healthcare-associated diarrhea is commonly due to C. difficile. Question 48. Which PPE is essential when caring for a patient with Ebola virus disease? A. Gloves only. B. Surgical mask only. C. Full body protective equipment. D. Eye shield only. Answer. C. Full body protective equipment. Rationale. Ebola requires maximum barrier protection. Question 49. Which action prevents ventilator-associated pneumonia? A. Supine positioning. B. Daily sedation interruption and assessment for extubation. C. Routine suctioning. D. Discontinuing humidification. Answer. B. Daily sedation interruption and assessment for extubation. Rationale. Early ventilator removal reduces VAP risk. Question 50. Which infection control strategy is most effective during a hospital outbreak investigation? A. Isolating affected patients. B. Restricting visitor access. C. Contact tracing and surveillance. D. Closing the hospital unit. Answer. C. Contact tracing and surveillance. Rationale. Identifying transmission pathways is critical to controlling outbreaks. You've just completed 50 infection control Nclex questions that every serious test taker must master. If you made it to the end, that already tells me something about you. You're not preparing casually. You're preparing like a nurse who intends to pass the Nclex on the first attempt. Infection control is not just an exam topic. It is one of the most tested and most dangerous areas in real clinical practice. One missed precaution, one wrong isolation decision, or one contaminated step can place an entire unit at risk. That's exactly why Nclex loves testing it. If some of these questions challenged you, that's a good sign. Tough questions expose weak areas before the exam does. Review the ones you missed, understand the rationale, and train your brain to recognize these patterns instantly. Remember these key takeaways. Always identify the mode of transmission first. Know your isolation precautions, contact, droplet, and airborne. Never compromise hand hygiene and PPE sequencing, and always think patient safety before routine. If this video sharpened your infection control knowledge, make sure you like the video, subscribe to MCQs Master 101, and turn on notifications so you never miss the next Nclex drill. And if you want more high-level Nclex practice, check out the other videos on this channel, where we break down priority questions, delegation traps, electrolyte emergencies, and critical care scenarios that many students get wrong. Keep practicing, keep sharpening your clinical judgment, and I'll see you in the next Nclex challenge.